Do you or someone you know suffer from nerve pain? It is painful and it can feel like a shooting, burning sensation. We're getting some answers today on how to possibly treat it with some new possible treatments for you. And with us is North Shore neurologist Dr. Chad Domingue with some of the latest research he has on this and how it can help you. Thank you so much for joining us.
Absolutely. Happy Easter. I've done my homework. Looking forward to sharing everyone as always.
Yes, and people love these segments when you explain, because so many people suffer from this. Explain again the symptoms of nerve pain and why is it some medical conditions like, say, diabetes trigger this problem?
We always describe it as a burning, lanciating on fire. So when the nerves on damage, it just shoots all the time. Just to put some statistics, as I like to do, they estimate that 20 million Americans suffer with neuropathy, but it's actually probably much higher than that. The most common cause, as you alluded to, is diabetes. The second most common cause in America is alcoholism. The most common cause worldwide is leprosy. We just don't see it here because we don't have any leprosy around. But unfortunately, a third of all patients with neuropathy never get an answer. As many as 50% of people with diabetes have neuropathy, and as many as 40% of people getting chemotherapy get neuropathy. You can also see it with things like mercury poison, which in our neck of the woods, bass, perch, tuna, mackerel have high levels of mercury. So I could explain why some of our viewers have neuropathy and never got an answer.
Did not know that about tuna. Okay, so you did some research. You've got some two potential things you want to highlight as possible treatments. Let's start with magnesium and the literature to support that and how it would work.
Yeah, so magnesium is an element. We all learned about it in chemistry. We've talked about magnesium in regards to anxiety and migraines. What magnesium does is it displaces a receptor called NMDA. And what NMDA does is it allows calcium to enter a nerve. So when a nerve is damaged, the calcium influx is at a high level and it causes the nerve to become hyperexcitable, so causing that burning sensation. So the magnesium blocks that. The data is pretty decent. The data in the animal models is really good. So they have the rats where they induce diabetes and the magnesium will fix it. The human stuff is kind of hit or miss. And one of our previous segments, the problem I saw with it is there's so many different forms of magnesium. There's chloride, sulfonate, taurate, and what you take in your mouth is not always what you absorb. So that was my critique of the human studies that I saw with magnesium.
Okay, and what is the second treatment for nerve pain that you want to highlight?
Yeah, so it's called N-acetylcysteine. For any medical providers out there, is what we give people that have acetaminophen or Tylenol toxicity. It is actually a medicine. It's derived from onions, of all things. Why is that? I don't know. It's a very powerful antioxidant. It increases a nerve growth factor, and it increases glutathione, which is also an antioxidant. So what it does is as these nerves are damaged, the mitochondria, which are the powerhouse of the cell, are misfiring and causing abnormalities leading to pain. So this antioxidant suppresses that. Very good literature, very safe chemotherapy models, rat models showing nerve function growing back. The dose that I saw was about 1,200 milligrams a day, but a really nice safety profile, and I really like this supplement for a lot of people suffering with nerve pain.
And so finally, for local patients who suffer from nerve pain, that burning, stabbing pain, and they want to try these, is this something local doctors like yourself would recommend, and which types of patients would it help?
Yeah, so anybody with nerve pain, diabetic neuropathy, chemotherapy-induced, nerve pain from unknown etiology, which is a lot of our viewers, unfortunately, always talk to your doctor, obviously. I would recommend a magnesium such as glycinate or taurate at 400 milligram because it does cross the blood-brain barrier. The N-acetylcysteine, as you discussed, is 1,200 milligrams. You can get that IV or by mouth.
Okay, and I guess if people want more information, they can reach out to you, the Cypress Point Pain Management Facility in Houma, to help them, because who wants to live daily with that awful pain?
Absolutely. No one does.
Okay, thank you so much, Dr. Chad. Appreciate it.
I want to give a shout out to your meteorologist, David Bernard. I've been doing a lot of watering, so I appreciate all these April showers, so I don't have to do all the watering to my plants anymore. One of my new bow ties.
Very nice. I'll make sure he sees that. Okay.
Appreciate
I always like
it.
those nice effects. Okay, appreciate it. Thanks. Bye-bye.